Alexander, and Alexander is a neuropsychologist and a psychologist with the Notre Dame Hospital, and at the same time an adjunct professor, researcher, and laboratory director in the Department of Psychology, Faculty of Arts and Science in the University of Montreal. So, Moreno, please.
Thank you so very much for this presentation. I'm going to try to be on time. I have a lot of information to show, but the good news is that part of what I'm going to present today is going to be presented by my students that are going to participate in the conference. So I'm going to give you a hint of what we're doing in our laboratory. And well, for the rest, I will let you know exactly where and when my students will be remotely presenting for this conference. So as I was mentioning, it's 4 in the morning in Montreal. So it's a pleasure to present this conference about technologies for home supporting community dwelling older adults through the continuum from normal aging to neurocognitive disorders. What I'm going to present here are the preliminary results of 3 systematic reviews about gerontechnologies in community dwelling older adults and their family caregivers without neurocognitive disorders, with mild cognitive impairment, and the third one is with dementia. So this is the evolution of Canada's population age 85 and older from 1966 to 2051, where we have 3 times more people age 85 and older, but 2050. So if we continue with this tendency, these are data from Statistics Canada showing that the portion of people living in collective dwellings increases rapidly with age from 18 to 89. So if you see this proportion here, you will see that for centenarians, almost half of them will be living in collective dwellings. But we know that this is problematic because, well, we just went through COVID-19, and we know that with the fear of infection and strict isolation measures in nursing care homes, and especially what we're experiencing worldwide in terms of lack of staff, aging in place is the ideal for a lot of older adults. And these are data from a survey from AgeWell, which is Canada's Technology and Aging Network, about the tech used by older Canadians for health, wellness, and independence in the time of COVID-19, where the results show that 88% use the internet daily, 65% own a smartphone, and 83% use it daily, and 23% use video calling on their smartphones. Also, the result of this survey showed that telehealth was used by almost half of Canadians, 50 years old and plus, and most of them were satisfied. 66% believe that technological advances can help to lessen the impact of COVID-19 on daily life. 76% felt confident about using current technology, and 67% are even willing to pay out of pocket for technologies allowing them to stay at home as they age. But this is the clinical reality of why co-designing and co-creating technologies for their adults is a very complex process, and it's complex because the heterogeneity of aging itself. So when you see this slide, you can understand that in terms of the way the evolution of a disease process, it is not going to be the same when we co-design technologies for individuals without cognitive impairment, or those who are in a preclinical phase with subjective memory or cognitive changes, those who already have an objective cognitive change in their assessment, and those who are in a disease process like dementia. And even within dementia, it's not the same when we design technologies for mild, moderate, severe, or moderate dementia. So from the point of view of the older adult, considering gerontechnologies. What we know is that the more we move to the right of your screen, well, the older adult should have access to a technology that will not demand any action from them. But we have to consider also the reality of family caregivers. And for family caregivers, is the opposite. Family caregivers and gerontechnology, they will have to be more and more involved and take control of the technology as you move to the right of the screen. So having given this explanation, what we see here is that gerontechnologies at different stages of this process, of the aging process, from normal to pathological aging, they will allow people to stay at home independently, like avoid these community dwellings. And at the end, what is important is to facilitate social participation, regardless of their status or disability. So this is our laboratory in the Montreal Geriatrics University Institute. So we are in the province of Quebec in Canada. This is Montreal, and this is our lab where we're conducting research at different levels, from medical to social and psychosocial research. And I'm going back to the first review. So for this one, my student Henrik will be presenting this Saturday at 5 p.m. the Mediterranean Room in the session about new technologies. So here what we wanted to do is to investigate the evidence-based technologies used for home support, targeting community dwelling older adults without neurocognitive disorders. And these are the criteria that we used, and I'm just going to present them once because they're the same for the rest of the reviews. So we included qualitative, quantitative, or mixed designed research articles, including case reports or group studies. We included literature available in 4 languages, English, French, Spanish, or Chinese. And for this particular study, we included a time frame from 2016 and 2021. And this is the methods for when we conduct these reviews. Normally, we start with the research, literature research, with 2 librarians who help us identify the records in the databases. Normally, we use Medline, PsycInfo, H-Line, Web of Science, and CINAHL. Using Covidence software, we can remove the duplicates that we have identified in these databases. And then the process of record screening with the student starts. So independently, they can verify inclusion and exclusion criteria. When there are conflicts, the supervisor takes the final decision. Then, following this initial record screening based on titles and abstracts, those studies that were selected are assessed in depth following the full text review for eligibility. And this is what at the end allow us to include the studies, like showing the evidence. So for the first review, for community dwelling older adults, you see the tendency here in the literature. Well, what we see is that people are very interested in this kind of research. With in 2020, we have almost 300 articles published per year. But the interesting thing is that when we go through this systematic process of reviewing the articles, only 13 provide evidence of the utility. So most of them are published in the United States, but we also see a few of them in Europe and in Asia. And most of the studies included the use of alarms or environmental monitoring, but also the use of sensors for example, movement detections are very are part of the technologies. When we regard the collaborations involved in these studies, most of them included nurses, computer scientists, or biomedical engineers. And also, well, in conclusion for this first review, gerontechnologies tested in community dwelling older adults and family caregivers for home support are mostly limited to 1 or 2 functions. And there is a need, there is a gap in research for integrity and easy to use and especially affordable technologies, providing a unified solution for the needs of home support for older adults and their family caregivers. And now we move to the second review with older adults with mild cognitive impairment and family caregivers. So for this review, my student Celia Kub will be presenting in the session of gerontechnologies tomorrow at noon in the Mediterranean room. And here, what we wanted to see is to do the same review, but this time we included a longer time frame in the past 10 years. So it's the same criteria. And here we see the distribution, but we see much less as compared to when we regarded, when we inquired about community dwelling older adults. So for mild cognitive impairment, the most we had were about 55 articles published in 2021. But when we went through the review process, what we saw is that none of these studies provided evidence about their use in community dwelling older adults with MCI and mild cognitive impairment. And the reason was mostly because the technology was not tested in both older adults with MCI and their family caregivers, or that the samples were mixed. But we were putting in the same group people with dementia and individuals with mild cognitive impairment, but the analysis was not performed or conducted separately. So we don't know exactly if these technologies are working, at least in the past 10 years, in individuals with mild cognitive impairment. So between 2012 and 2022, we were unable to find empirical studies demonstrating the utility of these technologies for home support, tested simultaneously in individuals with MCI and their family caregivers. And now for the third review, which is a review that is ongoing and is the one we still don't have a lot of conclusions as in the first. This is with people with dementia, older adults living with dementia and their family caregivers in the past 10 years. So the same criteria, and here is the distribution. So we see that, for instance, in 2021, there were almost 150 papers published on this subject. And when we went through the review process, only 25 studies were showing evidence of the utility of these technologies. So here we have the consolidated results to have the full picture of what is going on, at least in the past 5 years. So from 2016 and 2021, what you see here is that most of the literature published targets community dwelling older adults, followed by neurocognitive disorders, and the least studied is mild cognitive impairment. And here we have the 10 years just with mild cognitive impairment and neurocognitive disorders, where we see that definitely there is much less being done here. So in conclusion, here, family caregivers are a key component in the aging process, and they should be included when testing gerontechnologies in the whole spectrum of aging, from normal to pathological aging. As the results showed, the research in diets of individuals with MCI and their family caregivers are understudied. So if you want to do something original, work with individuals with MCI and their family caregivers for home support and technology. This is something that needs to be done. And especially at this stage where people have not turned to dementia or started the dementia process, this is the moment where these technologies can be adopted and probably be used during the disease process. And one of the principles in gerontechnology is that when gerontechnologies fail to show efficacy in people without cognitive impairment in community dwelling older adults, if they're not being useful at that stage when people do not have a dementia process ongoing, it is highly possible that their efficacy would also be questionable in MCI or neurocognitive disorders. So I want to finish my presentation with an invitation. I would like to invite you to my special issue. I'm the guest editor for a special issue in gerontechnologies for home support that I have the pleasure to launch today here at this conference for Frontiers in Psychology, Psychology of Aging. So people interested in submitting research in this area, the abstract submission deadline is April the 1st, and the manuscript submission is on September of this year. But the interesting thing with Frontiers is that we have what we call cross-listing. If you don't want to submit it to Psychology of Aging, Frontiers in Psychology, you can also submit it through Frontiers in Dementia, Dementia Care, Frontiers in Communication and Networks, IoT and Sensor Networks, Frontiers in Rehabilitation Sciences, Disability Rehabilitation and Inclusion, Frontiers in Medical Technology, Diagnostic and Therapeutic Devices, or Frontiers in Neurorobotics. So we really wanted to give to represent the transdisciplinarity of this area. You have the QR code if you want to scan it to have all the information about the submission process. And with that, I would like just to thank my team in the Innovation, Technology and Cognition Laboratory, to thank the organizers and especially Dr. Magda Solaki, with whom we're starting a collaboration on technology experience by older adults. And of course, the team of students who worked hard on these reviews, as well as our funding agency, the Ministry of the Economy and Innovation of Quebec. And to you all for your presence, thank you very much. If you have any questions, it will be a pleasure for me to respond. And I'm available on the LinkedIn and ResearchGate and Twitter. And if you want to have personal communication with me, I have my email is on the screen also.
Thank you very much, Alexander. I see Angelina has a question. Please, Angelina, go ahead.
Yes, of course. Thank you very much for the presentation. It was very interesting to hear about all this work, and also that the students were also able to work on all these systematic reviews. I think it's very important to integrate this knowledge, and also systematic review, of course, with that scope is a big chunk of work. I have a question regarding this. Maybe your students are going to talk a bit more about that when they have their respective presentations, but I'm just wondering, outside of the Western world, what are some of the home support devices and technologies that are being used? Because, for example, I'd be very skeptical regarding home support in Eastern Europe, for instance. So I just wonder if you can say something a bit about this.
About the kind of technologies that are used? Yeah,
and mostly outside of the Western world. I guess there's little literature on this, but
yes, well, if I just go back to what I showed here in the countries participating in the first, which is normally what we have is a few technologies for medication distribution, and as I was showing you here, well, the use of alarms, like when you have when somebody leaves the house, or when you have a sensor on the door, when the door is open, things like that. But probably, as I'm telling you, as you said, my student will have like the examples, the specific examples, but I can't recall exactly in Western Europe what the technologies were about, but maybe we can, well, either with him or by email, we can maybe share with you.
Sure. Yeah, it was just mostly out of curiosity, because it's quite interesting to see which of these technologies actually make a positive impact, because I reckon that some of the technologies might actually be confusing for a lot of these people to use, especially if they're not very tech savvy, which is the case with a lot of people in Eastern Europe, actually.
Okay.
But
probably
yeah,
what would be interesting to do at this stage is to conduct a survey, as what HWell has done, And maybe if you're really interested in this, well, we're collaborating with Dr. Solaki and her team in a cross-cultural study about technology use in older adults, and we're at the early stages of this research. So if you're interested in joining us and collect data that we could compare in Western Europe, that could be an interesting collaboration.
Thank you. Definitely, I'll stay on top of your work. Thank you.
Thank you very much. I have a quick question myself. In the very interesting reviews that you presented, the overview, you mentioned about evidence-based technologies. Can you please briefly describe some of them? What kind of technologies did you consider in these studies and reviews?
Well, we included in our keywords like any kind of technology that could help individuals get support at home. So we included technologies from robotics to sensors to reminders to
wearables and
what I showed there in that slide. Let me just see. We included video call, health monitoring, the use of cameras, fall detection devices. We had like any kind of technology. We really went very broadly on our search so that we could get anything out there that would be available. So, but this analysis is only completed for community dwelling older adults. We have we're extracting the data for dementia, and probably in the next conference we will be able to show more examples.
Okay, I see, Angelina, you have another question, but I don't know if we have to go on.
I think we should go on. I think
that's fine.
Yeah, maybe we can discuss directly.
Behind schedule. So I think you can, let's say, continue via email exchange or anything this discussion.